Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. As I said in my prior video, I'm going to be doing a series about organ failure. Thank you to those of you who commented and told me which organ system you want to hear about first. It was a split between the heart and the kidneys, and I figured since I just spent the entire month of February talking about heart disease, we can talk about the kidneys for a little bit since I haven't done that very much over here on this channel. So this is a three-part series about kidney disease and kidney failure. Today's video, we're going to talk about chronic kidney disease. This is a reminder that while I am a doctor, I am not your doctor, and another disclaimer, I am not a nephrologist or a kidney doctor. So I'm just going to go over the very broad strokes of chronic kidney disease rather than the details because this can turn into a complex medical discussion, but I figured we just want to hit the highlights. So in my past video, I talked about acute and chronic disease processes. Chronic kidney disease occurs over time, over months and years rather than hours to days. Chronic kidney disease affects millions of people worldwide. This is a very common disease process, so I figured we can start off here. Before we start on chronic kidney disease, we should probably mention what the kidney does when it's working in a healthy manner. One of the main purposes of the kidneys is to filter out toxins and waste out of the bloodstream and put it into the urine. Additionally, it also controls the amount of volume or water in your body. So if you drink a little bit extra, you may notice you have additional urine output that day. That's their kidneys doing their job. The kidneys also take part in regulating blood pressure, helping produce red blood cells, as well as keeping your bones healthy in different processes. So the elimination of waste is not the only job that the kidneys do. When the kidneys are damaged, they cannot do their job properly. So this might lead to an excess of fluid in the body or a decrease in the time it takes to eliminate waste from the body. There are multiple causes of chronic kidney disease. The most common is hypertension or high blood pressure, and I've spoken about this in my multiple hypertension videos, but hypertensive nephropathy is a very common cause of chronic kidney disease. This is when somebody's blood pressure over time is poorly controlled, therefore contributing to damage to the kidneys. If you have high blood pressure, but you take your blood pressure medications and follow with your primary care doctor on a regular basis to make sure that your blood pressure remains under control, you're less likely to have chronic kidney disease from this process. Another very common cause of chronic kidney disease is diabetes. Diabetes can lead to multiple chronic illnesses, and chronic kidney disease is one of them. And again, this is due to poorly controlled diabetes, where somebody's blood sugar is poorly controlled over time. The elevated levels of blood sugar can cause damage to the blood vessels. Over time, that leads to damage to the filtration system in the kidney. Glomerulonephritis is another common cause of chronic kidney disease. This condition causes inflammation in the kidney and can cause damage to the small filtering mechanism. Many of these conditions are hereditary. It's important to know your family history to know if you're predisposition to glomerulonephropathies. There are also certain types of glomerulonephritis that can be caused by autoimmune disorders. Polycystic kidney disease is another genetic disorder that can lead to chronic kidney disease. This disease process causes many cysts to develop on the kidney, and they can cause damage to the kidneys over time. Pyelonephritis also can lead to chronic kidney disease. This is an infection of the kidneys. If somebody has an infection in their kidneys and it has a lot of inflammation, it can lead to some scarring and damage, and somebody might end up with having chronic kidney disease due to this. Some people do heal completely and have a 100% kidney recovery from pyelonephritis, but there is always the chance of having chronic kidney disease or CKD after a kidney infection. And finally, there are some congenital abnormalities that can lead to CKD. These are abnormalities that somebody is born with. This might have to do with the structure of the kidney itself having abnormalities, or the ureters, which are the tubes that lead from the kidney to the bladder, to have abnormalities leading to chronic kidney disease. That's just a brief list of disease processes that can lead to CKD. Next, we'll discuss the symptoms of CKD. Many times, the earlier stages of CKD do not have any symptoms. Somebody may have chronic kidney disease and not even know it. In the later stages of kidney disease, someone might have increased fatigue, difficulty sleeping, they might have dry, itchy skin from the buildup of toxins. They may also have swelling or edema from excess fluid. They may also notice changes in their urine, either decreased output of urine or a foamy consistency to urine. And the foamy consistency is due to protein buildup in the urine. Chronic kidney disease is diagnosed based off of blood work and urine studies. The basic metabolic panel will give a result for the creatinine, the BUN or blood urea nitrogen, and the GFR, the glomerular filtration rate. The stage of kidney disease is based on the glomerular filtration rate. The metabolic panel also checks a patient's electrolytes. So if somebody has severe kidney disease, their electrolytes may be very abnormal. Someone with severe kidney disease that is uncontrolled might have a high potassium level, and this is life-threatening. There are also urine studies that a doctor can check, such as the urinalysis, the urine creatinine, the urine sodium, to help diagnose chronic kidney disease. The amount of protein in the urine is significant because protein is something that is so large, it should not filter out through the kidney. If you have damage to the kidney and you're able to pass protein into your urine, that means that the filtering mechanism has some abnormalities. The urinalysis also checks for microscopic blood. And if you have a high amount of microscopic blood, this can mean many things. Someone with a urinary tract infection might have blood in their urine, but it also may be a sign of a glomerulonephritis. The next studies typically are done to help determine what the cause of the chronic kidney disease is. There are some imaging studies your doctor may order if they're concerned for chronic kidney disease. Many times they'll look at the blood vessels leading into the kidney to see if there's any narrowing, and that may be causing kidney disease, if there are any cysts or any anatomical abnormalities. They may also want a kidney biopsy, especially if they're concerned for a glomerulonephritis. There are many types of glomerulonephropathies. They can be differentiated under a microscope with immunostaining. A patient's doctor may want to check their blood work over time to see what the degree of their kidney disease is. Sometimes people might have an elevated creatinine temporarily and it can come back down. That's typically acute kidney injury. So, if they want to make sure that this is a chronic process, then you will need to go back for follow up and probably further testing just to see what the trend in those numbers is. There are 5 stages to chronic kidney disease, and these are based on your GFR. And again, this is the glomerular filtration rate, so that's the rate at which the kidney is able to filter out toxins and do its job. Without getting into the nitty gritty, I will pop up onto the screen here the 5 stages. And again, this is something that a patient's doctor will probably follow up and look at over time just to make sure that that is indeed the stage they're in, because a GFR can fluctuate a little bit um, depending on different circumstances. But when somebody reaches stage 5 and end stage renal disease, that is when the kidneys have failed, and we go on to discuss further treatment options. I'm going to make a whole separate video about end stage renal disease, dialysis, and kidney transplant just because this video is going to end up being an hour long if I continue. So there's no treatment to reverse chronic kidney disease. The management of chronic kidney disease is to prevent the further progression of CKD going from stages 1 to 2, 2 to 3, 3 to 4, and then to end stage renal disease. We try to prevent the patient from getting to end stage renal disease as much as possible, and we want them to spend as much time in the earlier stages just so they can preserve as much kidney function as possible. Some of the things that might be done are to adjust some medications. If a patient's on medications that might be contributing to kidney disease, then the doctor might switch around their medicines, such as antihypertensive. Some of them can contribute to kidney disease. So the patient's primary care doctor or nephrologist may adjust their blood pressure meds to be a class of medication that does not affect the kidney as much. They'll educate the patient on what over-the-counter medicines to minimize, such as NSAIDs. These are anti-inflammatory medicines such as ibuprofen or naproxen that people typically use for pain. They may also recommend a particular diet if somebody is in the later stages of CKD and if there's evidence that their body is not filtering out as much of certain electrolytes. There may have to be adjustments there. Patient might also have to go on a fluid restriction if they have a tendency to have fluid overload. Their doctor might tell them not to drink more than a liter of half of water per day, 2 liters of water per day. And that's usually in the later stages of CKD. And again, these things are all very patient dependent. It's dependent on your stage of CKD, what your medications are, what your diet is, and what your lab work shows. So all of these are individual decisions with your personal physician, not me, the girl on the internet. I hope you enjoyed this brief summary of chronic kidney disease. I'm going to be doing a 3-part series on the kidneys alone. Next up is acute kidney injury, and then we'll finish off with end-stage renal disease, talking about dialysis and transplant. If you found this video interesting, don't forget to give it a thumbs up. If you want to stick around, you feel free to subscribe to this channel to learn more about the ICU and organ failure. I'll be back next Tuesday to talk about acute kidney injury.